Okay, so we got Sarah.
Thank you, Adrian, as well.
From Cary.
Yes, Sarah, do you work with gastric bypass patients? What success have you seen? Yes, we work with patients who have had all of the different surgical procedures. The most common procedure now is actually the sleeve gastrectomy, and I have many patients who have had the sleeve procedure.
We work with patients like this all the time.
Yes.
Some of them who recently had it, and some of them who had it, say, 5 years ago, and now they're gaining weight back.
Right.
It works for both patients.
Absolutely.
There's, I would say, the kind of struggle that's going on within obesity circles. This is a little inside baseball here, but the surgeons realize that over the long term, they need stuff like what we're doing. Okay, so they can anatomically change you, and for a few years it's working good, but you can, and the data is clear. You can out eat that and out drink that stuff, and so kind of we stay focused on 4 things. Okay, diet or nutrition, physical activity, behavioral modification, and medications. Okay, and this brings in the whole medical and behavioral side of things, and this is still needed in patients who've had surgery. So I've had patients who could only get down to a certain point with surgery, then do what we're doing here, and they lose an additional 50 pounds, for example. Right. So I think that if you're starting to gain weight back, come on. If you want additional help with your weight loss from the surgery, come on. We can help you. It's safe and works well.
Yeah, and I think it would be good to address some stigma at this point, because I do have many patients who they personally don't feel like surgery is an option because they say things like, well, everyone I know who has gotten it has gained their weight back, or the risks are just so high. And it is a surgery. It is a risk, but it is a very effective tool. It is not a cure.
Yeah.
But in obesity medicine, because it is a chronic medical condition, we really are treating over the lifetime. And surgery is one tool that for individuals who have a higher BMI or more weight to lose, or who just struggle more, it can really be an important or vital tool in order for them to begin their journey. And then the medical weight loss side, which is us, are able to help them continue it. So I would just say the risks are actually much, much lower for complications and death than even some of the surgeries that a lot of people get, like getting their gallbladder removed, getting their appendix removed. So that's an important myth to put to rest, as well as the myth that, well, everyone just regains their weight anyway. And actually that's not true. While there is some weight regain, the vast majority of patients who have had either the sleeve or the gastric bypass or something called the duodenal switch, they do keep a good amount of weight off, which confers extraordinary health benefits. Many patients, especially with the gastric bypass, if they started with diabetes before, it is gone, and it will be gone generally for life. So there are other health reasons too to get a weight loss surgery. And we live in an area, luckily in the Triangle, there are many health systems that offer weight loss surgery, and there's some great centers around here. The trick is also having us in your corner, because it needs to be surgical and medical in partnership, not, well, I will only do, the pills and see medical, or I will only do surgery. For some patients, it has to be both. Now, having said that, there are many patients in our practice who maybe were candidates for surgical intervention, and they have done beautifully with medical intervention without the surgical, and they did get to avoid any risk or surgical intervention. So that is absolutely a possibility and a probability. We have many patients who do that. That does not mean, though, that if you are considering a surgical option, that means that you're a failure on the medical side, or that you should have been able to do it without the extra help, because surgery, again, it's a tool. We need every tool we can have in our toolbox.
I agree with that 100%. I do. And I wouldn't, whether it's medical or surgical, I would never let your friends and colleagues promote the idea to you that somehow you are weak. That is baloney.
Yes.
Yeah, that's baloney.
Our patients are some of the hardest working, strongest, motivated people I know. And that really ties to that bigger issue of stigma is we really need to work on as a society and as individuals and as healthcare providers to stop associating weight struggles with any kind of personality flaws whatsoever. It is a medical condition that requires medical treatment and sometimes surgical treatment.
Yeah.
So we emphasize that. And even with self-talk, I talk to my patients a lot about that positive self-talk of really trying not to go down a rabbit hole of, well, I should have, then I would have, and I could have. It's like, no, what we're going to do now is move forward.
Yeah. The one final thing I would just say there before we announce the winner, okay, is that, look, obesity is the most pro-inflammatory disease, really, that your body is systemic inflammation. Think of it that way. A very pro-inflammatory disease. And so you don't have to lose a ton of weight to get really healthy. There's another reason to do it. You can really decrease that inflammation. And this matters in this era of kind of the COVID pandemic, if you want to call it that, because that's an inflammatory process. Once the infection takes place initially and the virus replicates, it becomes an inflammatory issue. And if you're already really inflamed, this can get you in serious trouble. And so, outside of age, the number one risk factor for dying from this virus is obesity. And it's because of this inflammatory business. So I've been saying from the start, don't act like you have to achieve some model's weight. You can lose 5 to 10% of your body weight and be eating right and getting some exercise. And this will dramatically, in my opinion, alter your chances of a negative outcome. And America needs to be doing it. We're not putting enough emphasis on that. So this is the place you can come and we can help you. And you don't have to lose a ton of weight to have a big impact on this sort of thing. So let's announce the winner of the Target gift card.
The winner is
my buddy, Barbara Burton. All right, Barbara. Yes.
Thank you for everyone who entered today for our gift card drawing and just for being here with us. Please submit your questions through our website, simonsmetabolics.com. Check out our recipes at the Casual Keto Doctor. Check out our emails. And we will see you in 2 weeks.
Sounds good. See you in 2 weeks, everybody.